Hello and welcome to today's interview. Today I have the pleasure of being joined by Dr. Hamza Hashmi, who is an assistant attending in the Myeloma and Cell Therapy Service at Memorial Sloan Kettering Cancer Center, and he is also currently serving as chair of i3 Health CME NCPD activity, Cracking the Code to Successful Stem Cell Mobilization in Multiple Myeloma. Today he's here to share with us some additional insights from the activity and also some perspectives in honor of Multiple Myeloma Awareness Month this March. So Dr. Hashmi, thanks so much for coming on the show today.
Absolutely. Thank you for having me here.
Of course. To start off, I'd like to introduce yourself and share about what you do.
Yeah, so I'm a multiple myeloma and cell therapy specialist at Memorial Sloan Kettering Cancer Center in New York City. And I have been in this role for over more than a year, but I have been familiar with myeloma patients and their journey for, I would say, nearly a decade now. And I'm excited to be here and share some of the updates that we have seen with multiple myeloma in the last 1 year or so since we have this recording, and also share some of the clinical pearls in this Myeloma Awareness Month in March.
Awesome. Looking forward to chatting today. So to start off, would you like to give us a brief overview of some of the trials and research that were discussed in this activity?
Yes, so as you know, multiple myeloma is second most common blood cancer in the United States. And every year, about 35,000 people get diagnosed with this malignancy. And about 7 to 10,000 patients are actually doing bone marrow transplant for this particular procedure every year. We do see that these numbers continue to grow over a period of time, despite having availability of novel cellular immunotherapy in the form of bispecific antibodies and CAR T cell therapy. I think the role of high-dose chemotherapy and autologous stem cell transplant for myeloma is here to stay. We have seen trials that have been done both in Europe and US that evaluated upfront versus delayed transplant for newly diagnosed myeloma, and both have shown improvement in progression-free survival, albeit no improvement in overall survival. Perhaps in longer follow-up, we'll also begin to see this. So in this particular program, we actually focused on stem cell mobilization, the strategies that we have employed over a period of time and how they have evolved. We briefly discussed about the different strategies, including use of growth factors alone, growth factors in addition to cycloxaphyr and motixafortide. And we also discussed certain circumstances and patient scenarios where the use of chemomobilization may be appropriate for these particular patients. We discussed some of the trials that have compared growth factor alone versus growth factor in combination with plerixafor and motixafortide, and how addition of these addition mobilization agents can actually not only improve the adequacy, efficiency of the procedure, as well as the stem cell yield that we procured with these procedures.
Amazing. Thanks for the overview. It was definitely a lot of fascinating trials that were covered in the activity. So I know one of the other things that was covered was strategies for mitigating poor mobilization and optimizing ASCT outcomes. I'd like to share with some insights about strategies and advice you have for this.
Yeah, so I think it's first of all, it's important to understand the patient that may be at risk of poor mobilization, and it's important to highlight that as we begin to use more and more of CD38 based antibody in the induction regimens, like DARA RVD, DARA KRD, ISA KRD, uh, giving this induction regimen in these particular doses for beyond 4 cycles up to 6 cycles can actually put our patients at risk of poor mobilization. It also applies to patients who actually receive radiation treatment during the course of induction therapy in higher doses. And hence, it's important to identify these patients with their age, with the bone marrow involvement, radiation treatment, and chemotherapy regimen, and cycles and frequency that they have received. For patients who are at risk of poor mobilization, or for that matter, patients who have actually already failed mobilization, I think it's important to have the preemptive use of chemomobilization agent, stem cell mobilization agents like plerixafor. Secondly, for patients who already failed an attempt at mobilization, I believe that the use of chemotherapy for mobilization purposes is very important.
Awesome. Great. Thanks for the insights. So why do you think the audience listening to this interview should the activity? Why is it important to remain up to date on this topic?
Yes, I think as I already alluded to the fact that nearly 35,000 patients are getting diagnosed every year in this country, and this number continues to increase because of our ability to actually detect myeloma early on. Also, with some of the diagnosis criteria that have evolved over a period of time, we'll continue to see this incidence be at the same number of 35,000 folks every year. And then, as transplant has made significant impact on outcomes with multiple myeloma, I do think the role of transplant is here to stay. Hence, it's important to know what are the important strategies, the clinical pearls, the key take-home messages when it comes to patients with newly diagnosed myeloma regarding the number of cycles of therapy, appropriate mobilization agents, appropriate strategies in case there is inadequate shield, and very importantly, what to do in case patients have already a mobilization failure, so that the patients can get adequate amount of hematopoietic stem cells for good outcomes post-transplant. Secondly, what we are also seeing now emerge is that CAR T cell therapy is being increasingly used for relapsed myeloma, and one of the complications for those patients is post-CAR T cytopenias. Many of these patients, if given a hematopoietic stem cell boost, can actually recover their counts in a timely manner and avoid cytopenias related complications, including infections and bleeding. And hence, it's important to be aware of and be able to collect adequate number of stem cells, not just for a transplant, but also for a user stem cell boost later on in case they receive CAR T.
Absolutely. Great to know. So since, as we mentioned, this March is Multiple Myeloma Awareness Month, are there any messages regarding stem cell transplant and multiple myeloma that you'd like to share and raise awareness of?
Yes, I think Multiple Myeloma Awareness Month is a great opportunity for all physicians, healthcare providers who focus on plasma cell disorders to create awareness regarding diagnosis of myeloma. And very importantly, also highlight the role bone marrow transplant has played over the years as a very effective form of treatment for these patients. And we do see that there are patients who never get referred for transplant. There are patients who don't have access to transplant. There are certain cultural opposition as well as scrutiny against procedure like bone marrow transplant. Many times patients are not familiar with the process of bone marrow transplant, and I may have some misconceptions regarding how it's done, how effective it can be, and what are the associated side effects. I think transplant has become very tolerable treatment over a period of time where transplant-related mortality within 100 days is actually less than 1% at all major academic centers in the country. We have gotten better with our supportive care measures, where it may not be as difficult a process to go through as it was perhaps 2 decades ago. And with the benefits that we are seeing with transplant in patients with myeloma, I think every patient with newly diagnosed myeloma should at least have a consultation or consideration of bone marrow transplant as a treatment option for their myeloma.
Great. It's a great message to wrap up on. So thank you so much, Dr. Hashmi, for coming on today to share these insights with us. It's exciting to hear about all these advances and your perspectives for Multiple Myeloma Awareness Month. To everybody listening, be sure to visit i3health.com or click the links in the description to view the full activity and claim free CME NCPD credit. Thanks again, Dr. Hashmi.
Thank you, Kara. Thank you for having me here.